This program is for educational purposes only. Before starting any health or exercise-related program, consult your physician. Welcome to Your Body for God with Dr. Tony Ganem. Dr. Tony is the clinical director of the Body Pro Wellness Center in Santa Ana, California. He believes that maximizing your health is critical in order to function at your best for yourself, your family, and most importantly for God, because the Bible tells us that we were created by Him and for Him. Time to maximize your health. Here's your host, Dr. Tony Ganem.
Hi, and welcome to Your Body for God Radio. This is Dr. Tony Ganem from the Body Pro Wellness Center in Orange County, California, bringing you a show that talks about glorifying God with your body. You have many things that God has given you as talents, as treasures, as gifts, and one of them is your body, the opportunity to use your health to serve Him well with energy and focus and strength. And last week we had a massive response to a show in which we talked about blood sugar, regulating your blood sugar, making your body so healthy that you can't be diabetic, that you reverse your diabetes, that you stop it from happening in the first place. And you can listen to these archives on our website at bodypro.com, or you can go to iTunes and look up Your Body for God or Dr. Tony Ganem or Body Pro. Any of those will get you into iTunes and the opportunity to download our podcasts from the past. And we've had a few listeners ask us recently, Dr. Tony, what about my blood value here and my blood value there? What does this mean? What does that mean? What does it mean about looking at your blood from a functional perspective instead of a reference range perspective? So I thought I'd dedicate today's show to talking about blood, things that you can learn about your blood from looking at your blood test. I cannot make you all clinicians on the radio. In fact, you'd have to go to school to become a clinician. But I am going to show you how you can look at your blood work from a different perspective. Let's start with this. If you were to get labs from 3 different companies, let's say Kaiser, LabCorp, and Quest, and you were to look at their reference ranges, would you believe that they would not be identical? I mean, your blood is being compared to those reference ranges, and you're being told whether you have something right or something wrong going on with your body based on those reference ranges. But they're different for every lab. In fact, they're different for every city in every lab. And that's because the reference range is not a range that tells me about health. It's actually a statistical curve that tells me what did most people who took this test, where did they fall between? Where did 96% of them fall? And that's not very good, because what that really is telling me is where did 96% of the sick people, because generally sick people are taking blood tests, how did they fall? And if I fall outside of that, I'm in the bottom 4%. That tells me I'm really unhealthy, but it doesn't tell me how healthy I am or how I compare to healthy people. In effect, a blood test is a standardized test. If I were to take a standardized test like an SAT against a whole bunch of 5-year-olds, I promise you I'll come out ahead. But that doesn't tell me how smart I am. That tells me how smart I am against a whole bunch of 5-year-olds. And the same thing is true of your blood test. When you fall within a reference range, it doesn't tell me how healthy you are. It just tells me you're not in the bottom 4% on a lot of these values. Now, some of these ranges that you see in your blood test are standardized across the nation. Like cholesterol, nobody wants to be above 200, and the pharmaceutical industry has a lot to say about wanting it to be 200, and soon they'll make it 180. But what would it be like if I compared my blood to a whole bunch of healthy ranges to find out how healthy I am instead of how sick I am? And what if I compared your blood to these reference ranges to find out where you are lacking perfect health, what things might be happening, looking for patterns of imperfections that could precede a disease so that you could fix them right now before they're called a disease? Wouldn't that be ideal? Well, it just so happens these reference ranges do exist, these healthy, optimal ranges. And these ranges that we're talking about, optimal, functional ranges, they come from associations like the American Diabetes Association actually says that your hemoglobin A1C, the value that tells me about how much blood sugar tends to be in your bloodstream over a 2 to 3 month period, should be less than 5. But your blood work will have a level that says keep it under 5.7 because above 5.7 you will have the beginnings of a condition called insulin resistance. Knowing that, wouldn't you want to be under 5, which means you likely don't have any kind of a blood sugar problem, as opposed to being under 5.7, which means you haven't yet crossed over to the land called insulin resistance and blood sugar problems? Normal ranges or reference ranges don't tell me about health. They're statistical ranges. They are made with a bell curve, also called a normal curve, and they basically tell you what's normal or what tends to happen in the United States or in your region. Normal is not healthy. It's normal to have blood sugar problems. It's normal to have heart disease these days. It's not healthy to have those things. So normal and healthy are two different things. Knowing this, wouldn't you want to compare your blood work to ideal and functional instead of just these reference ranges? So what I have done in my practice is I've compiled a list of ranges from the American Heart Association, the American Diabetes Association, the Vitamin D Council, the Endocrine Society, the American Academy for Clinical Chemistry, the Life Extension Foundation, the Institute for Functional Medicine, the Textbooks of Physiology, and many more places, in which I've aggregated these ranges that are ideal, which give me an opportunity to look at your health rather than your diseases, to tell me what's going on with your health. Now, just understand that when you're looking at blood work from the perspective of how healthy are you, and you find imperfections, that does not mean that you have a disease. What you want to do when you find imperfections is you want to look for patterns of imperfections. These patterns can give you clues about what's really happening to your body so that you can go deeper and do follow-up testing to find things, to fix them, and to be done with them once and for all. Well, what I've decided to do was to use the blood work of a patient that I just had yesterday, just to show you an example of a typical evaluation of what I go through in my office. I'm going to change the name of this person to Karen, and I'm going to simply tell you what was going on in her blood work. Just so you can understand, the first thing I want you to know is I'm looking at her blood work, and she has about 5 values out of 85 that have gone over the reference range. According to her reference ranges, her doctor might have said to her, you have a cardiovascular risk because I see an elevated C-reactive protein. And this means that your arteries are becoming somewhat inflamed and that there's a lot of inflammation in your bloodstream. And so therefore, we just need to keep an eye on this, and you need to get on some anti-inflammatories or some omega-3s. That would have been a good suggestion on their part. And things that would calm down inflammation in the body and lead a better lifestyle. They would have said eat better, eat less, exercise more. And if she were lucky, she would have been sent to a rheumatologist because she had the beginnings of what's called an anti-nuclear antibody screen, which means that there might be something going on with her immune system attacking her cells. And that probably would have been the extent of her doctor's visit right there. But I'd like to go over this blood test when we come back from break from a functional perspective to kind of give you an idea of how you can look deeper into your blood tests to tell you what might be really going on. Hang on tight. I'll be right back.
Coming up next, more with Dr. Tony Ganem here on Your Body for God. Stay with us.
Hi, this is Dr. Tony Ganem from the Body Pro Wellness Center. God's created an amazing body and you're designed to thrive. I believe that if every cell in your body were thriving, they'd have to use fat like crazy to thrive like that. And I have hundreds of patients who live this way, burning fat and thriving. Would you like to be full of energy and burning fat at the same time? Well, I'd like to invite you to our free seminar titled Your Body for God. We'll talk about weight loss, the thyroid, metabolism, cholesterol, blood sugar, hormones, sleep, and more. We're next to Calvary Chapel, Costa Mesa. It's a complete health and wellness seminar. It's God-honoring and it's free, but seating is limited. So register now at bodypro.com or call 888-300-1888. If you've been looking for a health solution with godly principles and incredible results, then call 888-300-1888 or simply register at bodypro.com. Body Pro. Honor God, find the cause, and be blessed.
Welcome back to Your Body for God. Once again, here's Dr. Tony Ganem.
Okay, welcome back. This is Dr. Tony Ganem. This is segment 2, and we're talking about how to look at your blood from a different perspective. How to look at your blood from a functional perspective to understand what's going on with your body from a healthy range, not from the perspective of how unhealthy I am, but rather how healthy am I? Where am I not perfect? What can I make better so that I can serve God optimally, have more fun, have more energy, lose more weight, function better, be the best servant I can be, and useful for God? So I'm looking at her, and we're calling her Karen. We're looking at her blood test. And the first thing I notice about her lipid panel, because it's the first thing that shows up on her blood test, is her cholesterol. And I notice her cholesterol is completely normal. It's 176, which is perfectly within the range of ideal. And so there's no problem with the cholesterol. She's not on a medication. And the only thing I learned about her cholesterol is that her high-density lipoproteins, HDLs, which are not cholesterol, they're proteins that carry cholesterol, are low, which tells me that her liver's not making these proteins that actually bring cholesterol back to the liver, which tells me that her body is actually using a lot of her cholesterol for purposes in the blood, somewhere else, but not in the liver. I notice that her triglycerides are higher than ideal, which gives me a clue that she's making some fat, either in the liver or through the cells not being able to use fuels properly, so they start making the stored fuel called triglycerides or fat. And so it gives me a clue that something might be going on with her body having more fuels than it is using at that moment. Then I look at Karen's C-reactive protein, this protein that your liver makes when your liver detects a lot of inflammation, especially from a type of inflammation called interleukin-6, which tends to go up with blood sugar problems, but it also goes up with massive infection as well. And her levels are not good. They're at 9.8. And technically, according to the American Heart Association and the Centers for Disease Control, this number should be less than 1 to be healthy. So she's almost 10 times higher than she should be. Now, this could be a major cardiovascular risk. What this tells me is that she has a ton of inflammation going through her bloodstream, which means it can inflame the arteries, and that's never a good sign because strokes and heart attacks, heart disease, they tend to follow that kind of inflammation. So I took it down to note that we have a massive inflammatory thing going on. Something's causing it. Let's see if we see something that's causing this inflammation. So in continuing, I look at the next value, which is the homocysteine. And her homocysteine is under 8.2. It's actually 8.2. And the lab range says to keep it under 10.4, which is what they tell you through Quest Diagnostics. Keep it under 10.4 for females, under 11.4 for males, as if that's a healthy number. Because according to the American Heart Association, the number should be less than 7, because anybody between 7 and 9 has a 26% increase of a stroke or heart disease. And then anybody between 9 and 11 has a 31% increase of heart disease. And anybody above 11 has a 74% increase of heart disease. And remember, I just told you above 11 has a 74% increase of heart disease, and the lab range for a male says keep it under 11.4. So imagine 11.3, according to Quest, for a male would be completely okay, normal. But 11.3, according to the American Heart Association, would be a 74% increase of stroke or heart disease. Lots of inflammation here. Remember, for a female, Quest said to keep it under 10.4, and at 10.4, you still have a 31% increase of heart disease. Her value was at 8.4 or 8.2, and according to the American Heart Association, it should have been less than 7. Which one do you want to follow? The one that says keep it under 7 and be healthy, or the one that says, if you're under a stroke factor of 31%, you're okay? Right. That's why we look at this from a functional perspective. This is her second inflammatory marker. What do you think I'm starting to think? I'm thinking there's inflammation. But the second thing I know is that when homocysteine is up, that requires B12, B6, and folic acid. And a lot of people have elevated homocysteine. It goes up when you have hormone issues, that your body can't clear hormones. It doesn't have the detoxification process in the liver called methylation. And these people need massive amounts of B12, folic acid, B6. But all three of those nutrients require stomach acid. And I started creating another checklist in my mind, which was, I wonder if she makes enough stomach acid. Let's see what happens. Her glucose, her blood sugar, was being kept in a normal or an ideal range, and that's good. That tells me her ability to manage her blood sugar when she's fasting was really good. that kind of put a little bit of a mark in the category of that C-reactive protein that can go up because of blood sugar problems might not be going up because of blood sugar problems. Just something for me to consider. And then I continue and I look at her blood urea nitrogen, her creatinine, and her estimated glomerular filtration rates. These are markers that tell me how the kidneys are doing, how the liver might be doing, and how much protein is she consuming, is she absorbing. And this told me that her blood urea nitrogen and her creatinine were less than ideal, which gave me a clue that her body might not be absorbing a lot of proteins, or her liver might not be dealing with these animal proteins properly. So I went on to ask her, do you eat animal protein? And she mentioned to me that she was somebody who ate 2 meals a day that had animal protein. To which I said to myself, I'm wondering if she makes stomach acid, because it requires stomach acid to absorb proteins. You can eat them, and you won't fully digest them, and they can come out the other end as, undigested proteins, otherwise known as stool or manure. But the question is this stuff getting inside your body? Is your body getting proteins? This was another check mark in the category of it requires stomach acid to digest proteins. I'm wondering if she makes enough stomach acid. I saw that her salts were within range, and that made me really happy. Her sodium, her potassium, and her chloride, they were all within range. And then I also saw that her estimated glomerular filtration rate, which tells me how her kidneys are doing, thankfully, were really, really good. But this is a good place for me to kind of mention them for a moment. The glomerular filtration rate, how your kidneys filter things, the lab ranges generally say keep it above 60. But the National Kidney Foundation says that if it's under 60, you actually have a chronic stage 3 kidney problem. You want to keep it way above 60. The National Kidney Foundation actually says keep it between 90 to 120. Here's another example of that reference range being way off. It might tell me that you're not in stage 3 chronic kidney disease, but it doesn't tell me how healthy your kidneys are. Are you getting the picture? Looking at your body from a health perspective instead of from a disease perspective changes a lot of things. Let's go on to talk about the calcium and the total protein numbers. I was looking at her calcium, and it was less than ideal. And that could mean that she's not digesting calcium, that she's not eating calcium, that she's not taking it in. But it could also mean that she lacks stomach acid, because calcium requires stomach acid for absorption. Vitamin D is required for the absorption of calcium, but vitamin D also requires stomach acid. So you can see where this is going. I have another check mark in the category for less than adequate stomach acid. And then I see the total protein, which is the proteins made by the liver. They were less than ideal, which is another sign of maybe lacking stomach acid. And so I started saying, this is really looking like a lack of stomach acid. And so I went on to look at her testing, and I looked at the alkaline phosphatase, which can give me clues about zinc, and you get it. Zinc requires stomach acid. In fact, you can't even make stomach acid unless your zinc levels are ideal, which makes you have a conundrum. So when I see people whose alkaline phosphatase is less than ideal, meaning their zinc is likely low or the vitamin C is low, sometimes that can tell me that I need to give them a zinc under the tongue, something that absorbs under the tongue, because they won't have the stomach acid to absorb the zinc. But once they get the zinc in under their tongue, it gets into their body and they may be able to make stomach acid. This is something I do with people who show low in zinc. As I continued, I saw that her liver enzymes, AST and ALT, were on the border of low. Most people worry about them getting high. I worry about them getting high too, but when I see them low, it gives me a clue that they might be low in vitamin B6. You get it. It requires stomach acid. And then I went on to look at the hemoglobin A1C, which is the marker for diabetes risk, and she was at 5.4, which is less than the lab range of 5.7, which tells me that she's not insulin resistant, quote unquote. But according to the American Diabetes Association, people who don't have diabetes or don't have blood sugar problems should be under 5. And so this isn't ideal. This tells me her blood sugar tends to be staying elevated a little longer than they should. So it does give me a clue about some blood sugar issues. And then I went on to look at her vitamin D. And her vitamin D was at 32, and the range was 30 to 100 on the reference range. So far, all these values that I've just mentioned, except for the C-reactive protein, they're all within the reference range. But 32 might be within the reference range of 30 to 100, but it's not ideal. Many organizations say it should be between 50 and 100. The Institute for Functional Medicine, the Life Extension Foundation, for instance. I like it between 70 and 80, but the Vitamin D Council recommends that it's above 120. Now, I like it between 70 and 80. So many things in the body require vitamin D. The Human Genome Project showed that vitamin D affects 3,000 genes and affects 300 tissues. Vitamin D is a fat-soluble vitamin, along with vitamin E and vitamin A. These affect the membranes and affect hormones and affect how things work in your body to a great degree. But vitamin D also requires stomach acid. You guessed it, check mark in the stomach acid direction here. Her magnesium was less than perfect, and you already know what I'm going to say. And her phosphorus was less than perfect, and that is the same thing. They both require stomach acid. And so far, what I'm telling you is I'm seeing a big pattern of stomach acid. And I have to be telling you the truth that right now I'm thinking about does this woman have the number one cause for lack of stomach acid, which is H. pylori bacteria. It's a common bacteria. 50% of the United States has it. And if she does have it, the interesting thing is that H. pylori bacteria is also a major cause for elevated C-reactive protein. People think of it as the bacteria that goes inside your stomach and into your small intestine and stops you from making digestive acids and so forth, but people don't think of it as the bacteria that also goes into your arteries and causes inflammation right in the arteries themselves. This is a massive possibility for her. I looked at her thyroid hormones, and her thyroid-stimulating hormone was higher than ideal, which is interesting because she was actually making enough thyroid hormones, so that means that her pituitary gland had no clue about what her thyroid needed. And this happens with inflammation a lot, but most people don't test both of those at the same time, so they don't see this incongruency between what the pituitary thinks the thyroid is doing and what the thyroid really is doing. Inflammation causes that as well. So far I have two major things going here. I have a theme that says inflammation, 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 and I have one that says stomach acid, stomach acid, stomach acid. And so you follow this theme a little bit longer, and here's what you find next, is she makes enough thyroid hormone, but when it gets to the liver has a hard time converting this thyroid hormone to the usable form called free T3, and it's actually making a lot more of a bad type of thyroid hormone, an unusable type of thyroid hormone called reverse T3. And this reverse T3 can block her useful thyroid hormone and cause all kinds of limitations on her ability to have a metabolism. And inflammation causes this to happen, and so does lack of selenium and lack of zinc, two more things that require stomach acid. Now, we're going to come back from break in just a moment, and I'm going to conclude this, but I hope you're really getting the picture of looking at your blood from the perspective of health and not from the perspective of disease. All right, hang on tight. I'll be right back with more information.
Coming up next, more with Dr. Tony Ganem, here on Your Body for God. Stay with us.
Hi, this is Dr. Tony Ganem from the Body Pro Wellness Center. God's created an amazing body and you're designed to thrive. I believe that if every cell in your body were thriving, they'd have to use fat like crazy to thrive like that. And I have hundreds of patients who live this way, burning fat and thriving. Would you like to be full of energy and burning fat at the same time? Well, I'd like to invite you to our free seminar titled Your Body for God. We'll talk about weight loss, the thyroid, metabolism, cholesterol, blood sugar, hormones, sleep, and more. We're next to Calvary Chapel, Costa Mesa. It's a complete health and wellness seminar. It's God-honoring and it's free, but seating is limited. So register now at bodypro.com or call 888-300-1888. If you've been looking for a health solution with godly principles and incredible results, then call 888-300-1888 or simply register at bodypro.com. Body Pro. Honor God, find the cause, and be blessed.
Welcome back to Your Body for God. Once again, here's Dr. Tony Ganem.
Well, I hope this show is blessing you. In fact, I hope this ministry blesses you. We're on 2 radio stations, and soon we're going to be cutting down to KKLA only and staying on iTunes. And you can always get our broadcasts on bodypro.com or through iTunes. I hope this blesses you and inspires you and makes you think of your health from a different perspective. Actually looking at how healthy you are and actually trying to become healthier every single day. You know, the entire world thinks that we're destined to become less and less healthy every single day because that's what the laws of physics say, that entropy means that things get worse over time. If they're left alone, that's what it says. But we are not left alone. We have God working on our behalf, controlling our physiology and making it function right. We're not left alone. And we have the ability to tomorrow become healthier than we are today. We don't see it too often because we don't find too many people who try that. But I challenge you, try to become healthier tomorrow than you are today. I see it in my practice all the time, and I'd love to bless anybody I can. And that's why I do this ministry, to teach you, and I give free classes. And I would love to teach you. Come to our free seminars by calling 888-300-1888. I'd love to be somebody who teaches you how to become healthy. Let me continue with Karen here and finalize this. We did find that she had the beginnings of an autoimmune issue going on. We did a screen that showed her anti-nuclear antibodies were elevated, which gave me a clue that that could be a cause of inflammation in her body. But I also found an elevated white blood cell count that didn't pass the reference range, which told me she might be fighting something because it's almost at the reference range. And then I looked at her neutrophils, the percentage of white blood cells that were becoming neutrophils, which tend to fight off bacterial infections. And it was massive. 80% of her white blood cells were neutrophils. Now, because her white blood cells weren't past the reference range, her doctor probably wouldn't have done something about this. But I've already seen a pattern here of she is not absorbing nutrients. And the number one thing that's affecting all these nutrients seems to be stomach acid. And I know that the number one cause of lack of stomach acid in humans, 50% of the United States, is H. pylori bacteria. And so my next step with her is to actually do an H. pylori bacterial DNA stool test to see what is coming out of her stool. Is H. pylori overgrown inside her body? And should she do something about that? And when she finds this out, it can change her life. I mean, it can make sure that she gets more nutrients absorption for sure, but what about the cardiovascular disease that she's on the verge of? Knowledge is power. Having more knowledge about your health is powerful. Your choices are always to just kind of allow sickness and disease to take place or to do something about it. I challenge you not just to deal with your symptoms and diseases, but actually to choose to change your mind, like it says in Romans 12, and choose to maximize your health. God bless you.
You've been listening to Your Body for God with Dr. Tony Ganem, a doctor of chiropractic and a certified holistic nutritionist. To learn more about Dr. Tony's free nutritional health and weight loss seminars, go to bodypro.com. That's bodypro.com. The views and opinions expressed on today's program are those of Dr. Tony Ganem's and not meant to take the place of your doctor's advice. Your Body for God with Dr. Tony Ganem is sponsored by the Body Pro Wellness Center.